our final fifth speaker for the day, amazing, Dr. Jeffrey Nelson. He's amazing. His medical specialty is reproductive endocrinology and infertility. Now, this is going to be a big deal for a lot of people, but we have some people on our team that they are big into having babies in their 40s. And so they're going to really thoroughly love your section here as we talk about infertility and reproductive health and all of that. So can you please, first of all, just give us a brief background of who you are, your medical training, and how you got, here right now?
I would love to. First of all, just greetings, everybody, and happy Saturday, and congratulations for people coming on to spend time with us. And good morning or good afternoon, wherever you are. I think, Rachel, it's still morning there. And I also wanted to thank you guys for inviting me to participate in this panel with these magnificent colleagues of mine, both in the medical world, but also in the LifeWave world as well, too. And so I am a 68-year-old retired physician. And I'm kind of near where you guys are. I am in Southeast Florida, near West Palm Beach. My wife and I moved here back in June of 2024. My wife is Priscilla. You ever meet her? She loves to be called PJ. But we moved here in 2024. That was about 6 months after I retired. I retired December 31st of 2023. We still do, though, have three adult kids in Pasadena. Garrett's 34, Emily's 26, Cole, our middle kid, is 29. And so if there's any believers out there, put us on your prayer list because I'm hoping that they're going to at some point in time make a decision to move here to South Florida as well. So we'll see how that goes.
We'll
But
do it.
after medical school, I did a residency in obstetrics and gynecology, and I followed that up with doing a subspecialty fellowship in reproductive endocrinology and infertility. So like you said, I'm a fertility doctor. But after my fellowship, I went from Philadelphia to Pasadena, California, joined a couple of guys in practice, and we called ourselves HRC Fertility. But I'm very proud of the fact that over 31 years of being there before I retired, we gradually grew from a three-man practice to being one of the larger fertility centers in the country. And I'd like to think hopefully highly respected. But, it was very rewarding and very fulfilling, really helping people that are having difficulty with fertility all around the country, but also all around the world. But it was a stressful thing too. And so, I was doing 24-hour, 7-day week call, and I'd go to work at 6 a.m., get home at 6 p.m. And at some point in time, that was enough. And it was time to change, to close that chapter and just pursue other adventures. And one of those adventures is partnering with LifeWave. So really super happy to be part of this.
I love that. And I love, I'm praying for the kids to come there because I'm all about the family unit over here. So I
Exactly.
appreciate that. Come on. We have a lot of fun together. So it sounds like your wife is a true joy. I love it.
She
And
is.
so how were you first introduced to LifeWave? Was it you or was it her? Or how did you find out about this technology?
We've always kind of been involved in sort of the health and wellness space, even when I was in practice. And we were introduced to LifeWave back in October of 2024. And it was really just seeing some random Facebook posts. And I mean, I really just kind of like a lot of people, I was very skeptical, even kind of the point of being beyond skeptical to being dismissive of it. I was in 40 years of medicine, with my training, with my expertise. It just didn't make any sense that such a small device would have such profound effects on so many people for so many different things. And so I just disregarded it. And I kind of say that I sort of fell prey to an affliction that I think we have as Western people in the healthcare profession that I think people call ignorance from arrogance. We see something that we're exposed to that we don't understand and is foreign to us. And then rather than be open and try to research it, because it's new, we just sort of disregard it and push it aside and kind of move on. And so I was absolutely guilty of that. But luckily, we had a friend who also was on Facebook, and he's a guy that we turn to for nutrition advice, for health and wellness, for workouts, and also but for supplement stuff. And so he was wearing the patch. And so we thought, you know what, maybe we need to have an open mind and talk to Casey. And we did, and we liked what we heard. Started trying the patch. We started trying it back in November of 2024. And a really big deal for me was I had heart surgery back in 2015. And I did find, interestingly enough, it was the same heart surgery my father had at the same age I did And unfortunately, he passed away on the operating table. So it was a big deal. I got through that and did fine. But what I was left with was a little bit of a cardiac dysrhythmia. I had an irregular heartbeat that was persistent. And it wasn't something that was life-threatening, but it was kind of disconcerting thinking that something wasn't just quite perfect inside. And I saw David Schmidt do a YouTube presentation, and I think he was in the middle of a study, but he kind of wanted to break in because he was seeing an interesting outcome. And he saw that after being on the patch for 6 weeks, he was seeing a reduction he was seeing an improvement in a reduction in cardiac age by 2 years after 6 weeks on the patch. And so I thought, I'm probably not going to feel anything because it's inside as my heart, but it's not hurting me. There's nothing going into my system. There's no contraindication. So why would I not want to try that? And within 6 weeks, my heart rate went back to completely normal again. And it's really amazing to me because I know last night I was kind of laying in bed and thinking about this. And when you're in bed at night and it's quiet, you can really feel your heartbeat. And that irregularity was always there. Priscilla would hear it because she puts her head on my chest at night, but we never talked about it, and so, but now it's just so nice to have that be gone. So the patch, there's at least a correlation with wearing the patch and something with the conduction system in my heart. That's incredible. And the other thing is that I had kind of chronic aching in my hands, and being in Florida now, I like to fish, and it wasn't like debilitating, but it was annoying. And that within about 2 months, that disappeared as well. And the very final thing for me was that I had really severe gastric reflux, and I was on medication for that really for 15 years. And I tried to get off of that. And it was, within 2 days, I had to go back on because it was so miserable. And God bless Priscilla. She would get all these over-the-counter remedies and mix all these things up, and nothing really benefited. Um, but after being on the patch a year, I thought, let me try it again. I was kind of afraid to stop because I was afraid to fail again. And so, but I went off the patch, and that's been now almost 8 months ago. And maybe I've had a couple of Tums here and there, but that's been gone. And when I talked to my gastroenterologist, he really had nothing for me. It's just that's
Wow.
just sort of what you're going to do. And so those are kind of the breakthroughs that I had, which has really unbelievably improved the quality of life. Priscilla wasn't sleeping well. Now she sleeps through the night. A son with asthma was frequently using rescue inhaler. Now he's done with that. He uses it maybe once a month, and
Wow.
his acne's disappeared. So really, I just have nothing but great things to say about the effects of the plant
Wow.
in my family.
And I would say seemingly for all of those great testimonies you
Seemingly.
just heard, seemingly, right? And
Seemingly.
again, we can't speak for everybody that's watching today because individual results are going to vary. But we just are so honored that you're sharing your story, your specific family story and your journey, because it's powerful. You don't know who's listening today, who's been praying for something that you just mentioned, right?
Yep.
So
Yep.
what if there was a possibility, and what if that could come alongside and support some of those ailments and things that they have
Yep.
going on to help to start to see some improvement?
Yeah.
It's
And
exciting.
in a matter of minutes, I heard you share some profound benefits, Dr. Nelson, that you experienced, that Priscilla, PJ, experienced, that your family members experienced. You also shared some information that kind of turned on a paradigm from you that you heard from David Schmidt. Also someone that you, looked up to in terms of receiving advice from, different modalities of health and wellness. But was there something that ultimately was the cause of you and PJ taking a look at this and really starting to promote LifeWave as an opportunity and a product?
Yeah, but Priscilla and I've always had kind of an entrepreneurial spirit. And we really wanted to have a home-based business that we could do together. And we actually started doing some of those things while I was still in practice. Because also, kind of like Larry had said, we just really felt the financial security by having multiple income streams because you just never know, right? And so, but also we wanted something that we could continue into retirement. Because I like to fish, but I don't want to fish 24 hours a day. And so I still wanted to be useful. I wanted to be productive. And we really wanted to have a sense of fulfillment and purpose, which is genuinely really only achieved by serving other people. And so that's kind of what we wanted to do. We wanted to have a business that we could do that. And people always talk about the common things people wish, pray, hope, and dream for, which is their physical health and their financial health. So we wanted a business model that would meet both of those needs. And so just looking at, LifeWave with the technology, with the business, I mean, the technology to me in the field of health and wellness, I've not seen anything ever like this. And it sounds kind of corny, but it fits all the adjectives that you hear about groundbreaking and transformative and revolutionary, paradigm shifting and life changing. I mean, it really is all that stuff because the non-invasive support that allows, supports your body to do what it was designed to do, which is to heal itself, which has been brought up a bunch of times today too. And I never even heard that until I was on a rotation. An orthopedic surgeon said to me, "Do you realize the body doesn't heal itself?" And it's like, oh, I never, and that's pretty obvious, but I never thought of that before. And anyway, the technology is groundbreaking, and I love the fact that it also is working foundationally. You talked about symptoms. This is working foundationally at the cellular level, and that's an amazing thing. And business wise, I've never seen anything like this business model. We have such a minimal investment, and the final thing is just community wise. Everybody wants, craves community, but you need to have it be a healthy community. You need to have the right people you're being discipled by. And I love the LifeWave family, because everybody's dedicated to bettering themselves and to serving other people. And so because of the tech, because of the business, because of the community, we're just all in, and we love working with LifeWave.
Wow. And we love working with you.
Right.
You're such a blessing. Wow. That is just I mean, you know what I love? I can tell that you just adore your family. And we're kind of
I
those
do.
family, like we're generations of health and generations of wealth, how David Schmidt talks of. And so that's really like a purpose for us, right? We want our family to be healthy together and to have adventure and create wealth and serve others and bless others together, because the family's a unit. I always say we travel as a pack. So I love that you're bringing your wife along for the journey. Honestly, I feel like marriages, I'm not making any claims here, but I feel like when you start working LifeWave as a couple, the marriage gets better. I'm just saying. Okay.
I agree.
We've noticed it.
Yep.
You're probably noticing
So
it.
far, so far, so good.
It's so far so good. It's something
It does.
fun.
It gives you this amazing sense of purpose, and it's fantastic.
Together.
Yeah.
Focused energy. I love that. Okay. Any final questions we have for him? So we know that you're all in. We can tell. We can feel it. We can hear it. Let's go back to the technology just for one more second. Why do you have the confidence in this LifeWave technology? I mean, why foundationally? You just said you learned from an orthopedic that said, hey, the body's designed to heal itself. And that was the first you heard of that. But how can you come here and with certainty say, I have confidence in this LifeWave technology, this patch?
Well, this is kind of a rabbit hole, so I hope you'll indulge me in that. And so I do believe strongly in the power of the X39, really because the abundant amount of clinical evidence that's out there to support it. But we need to be able, as life care brand partners and healthcare practitioners, be able to take that confidence and somehow translate that to other people so they better understand what's going on. And we live in a super, super skeptical world. And so I spent the better part of 43 years of my life immersed in the Western medicine paradigm. So my sphere of influence involves a lot of similar people: doctors, nurses, nurse practitioners, chiropractors, acupuncturists. And when it comes to skepticism, most people have a little bit. You introduce this kind of weird device to them, and they're a little bit kind of wondering what's going on. But with healthcare practitioners, the skepticism is kind of on the hyper side. And so, but they're kind of like me, like I say, I came at this from that ignorance of arrogant stuff, and it took me a while to really be able to sort through that. And so, because those are the people that I deal with a lot, I'm not sure if there's a lot of healthcare people on this call, but hopefully this will address them, but also everybody. But I thought of what's the most effective way to approach people in general, but also people in the healthcare industry, to try to somehow diffuse their skepticism. And I thought you need to frame it and use the language that they understand. And to me, that comes through kind of clinical study analogs, things that they're familiar with. And so here's my rabbit hole. But first of all, is that we're built on a super solid scientific foundation because of the brilliance of David Schmidt. Obviously, he created this wearable patch that stimulates, uses a specific wavelength of light, like Rachel had said, stimulates the skin to produce copper peptide. And we know that because he proved it, because he does have a double-blind placebo-controlled trial that shows that peptide will elevate when the patch is used, and that's patented. So we know that's the case. But the real big question is that, does the proven elevation of copper peptide cause the beneficial clinical effects that were predicted by Lauren Picard's research? Does the elevation of that peptide because of the patch really result in the beneficial effects we would expect because of research on copper peptide elevation? And so that's kind of where my healthcare partner friends come in. They kind of have a little bugaboo and say, the problem with you guys is you have no clinical trials. You guys just have testimonies. So I wanted to take a look at testimonies and show the power of testimonies and compare that to what as healthcare people we look at as real world clinical studies. So what's a real world clinical study? In my practice, because we were just a very big practice, we kind of encouraged ourselves to publish a lot. So we were always putting together studies, the docs, the embryologists, and we would try to present at all of our major meetings around the country and internationally. And so we just did a lot of that. And so what is a kind of a real world study? It's not double blind placebo controlled stuff because not many things really lend itself to that design. And so the problem there too is that those things really need to be well funded because they're expensive. And the greater cost to something, the greater risk of bias, because what tends to happen is the result gets tailored to the person, to the agenda of the person who's putting up the money. And so most studies aren't like that. The majority of things that we would do kind of fall into three categories, which are case reports, case studies, retrospective chart analyses, and things we call prospectively designed studies. And so I want to looking at those study types, what analogies do we have in LifeWave to give people confidence in what they have? And so with the whole case report thing, we just would look at a single patient. There's some interesting thing going on. We thought it was worthy of reporting that. Not much power because it's one person, it's anecdotal, but still there's some interest there. And so LifeWave, we have that analogy, which is our single client testimonies. So testimonies are powerful and they're interesting and they're worth reporting, but it's similar to what we would do as medical folks. So it correlates. The second thing is the whole retrospective chart analysis, chart review thing. We would just review charts, a series of patients looking for something that might pop up that was of interest that we were mining for things that we could then go ahead and publish. It's a little more powerful because there's more people. And so the analogy we have with LifeWave is we can accumulate a bunch of client testimonies, which is clinical information on similar issues with similar outcomes. And that then becomes are basically analogous to that retrospective chart review thing. The final thing is, and this is really kind of neat, is that the nice thing was to do prospectively designed studies where we would prospectively determine a treatment, let's say, we would subject people to that, a series of patients, collect the data, analyze it, make up conclusions. And this is the most powerful of all those three. But in LifeWave, we've been kind of lacking that particular thing. But now they're starting to surface because I've been kind of looking for some of these things. And I've gotten three examples I'd like to share really quickly. But this is where the whole disclaimer thing comes in, that the patch does not heal you, that the patch supports your body's ability to heal itself naturally the way it was designed. You might see a temporal correlation with patch use and outcome, but correlations do not equate to causation. So I'm just going to say, the patch does not heal you. And so there were three studies. One was an orthopedic surgeon who's in Northeast Florida, and he does hip surgeries. And because of his introduction to one of our brand partners who had hip surgery with him and recovered within 2 weeks of his surgery, the doc said, "That's pretty crazy. How did you do that?" And he showed him. And the doctor did not want to prescribe the patch, but he referred patients. He referred 69. And of all 69, and his usual recovery time is 8 to 16 weeks. And with these 69 people, they all recovered within 2 to 4 weeks. And again,
Wow.
correlation is not causation.
Right.
There's a gastroenterologist out there he's done colonoscopies on 19 people, and he's documented, I won't say that, but he's seen ulcerations and inflammation within the intestinal mucosa. Put people on a patch afterwards. I think it was 3 to 4 weeks, rescoped everybody, and the words he used were everybody's colons looked pristine. So that's a pretty big deal. And there's a oculofacial plastic surgeon. Now he's very public, which is great. He's in the Tampa area, and he's got some kind of facial thing that he does that's unique, and a lot of people come to him from around the world. But he had a very elaborate set of postoperative recovery things that he would do with, I think, hyperbaric chambers, all kinds of stuff. And so he was introduced to the patch, and now he's replaced those things with using the X39. And he shows a whole bunch of before and after pictures with utilization of the patch. And so now so really summary wise, LifeWave testimonies are powerful, and they're analogous to all the other things that we did as healthcare practitioners to look at data. And so we shouldn't poo-poo testimonies. They're very powerful. All those different case types. And so the hope with all that I just kind of went through is that I wanted to kind of frame our evidence of testimonies in a way that diffuses some of the skepticism, in particular because of our colleagues out there in the healthcare world, but also hopefully makes everybody else confident in what it is they have in their hands. But a key takeaway to me with all this is that there just is unbelievable power in testimonies. Testimonies are evidence, and there's abundance of evidence. That evidence is continually accumulating and it's continuing to grow. And so the very final thing I'm going to say is the good news here is that all that stuff I just talked about, nobody has to know any of that. Nobody has to remember any of that. They just need to know that when you put a patch on somebody, that is a possibility of changing their life. There is nothing more powerful to me to optimize your health and to prevent disease, because again, the patch just supports your body's ability to heal the way it was designed and to heal naturally. And so I just recommend everybody out there just be a consumer of testimonies. Gives you great confidence in what we have in our hands and that everybody needs to have access to. So,
wow.
Oh my gosh.
Like, I loved all of that. And I love that, like, you've dug deep and you found those 3 cases. And I just think like there's patterns that are happening here, right? I've always said to Scott, not this many people can get together and lie. Like, I mean, none of these people know each other, right?
Yeah.
So they're
Yeah.
getting together and there's patterns of great things that we're seeing. And so why not talk about it, right? It's a great thing.
Yeah.
And I also believe the most brilliant people on the planet are not the ones that learned something 50 years ago and held their ground and they're still talking about it. I feel like the most brilliant people are learning new things, learning innovation, like the phototherapy patch, gaining that knowledge, and then making different decisions because of it. Like
Yeah.
those are the brightest people on the planet, right? And so, wow, you are a blessing, Dr. Jeff Nelson. I could listen to you all day. I love
That's
everything
great.
you
Thank
said.
you.
You're
Okay,
amazing.
thank you. Thank you for indulging me. I appreciate it.
We appreciate it. And, people just need to hear that because there are those healthcare practitioners, like you said, you said it best. What is it? Arrogance
Ignorance
from
arrogance. And I
Yeah.
can
And
say that because that was me.
yeah.
And this whole thing with LifeWave has led me down a whole different path, which has been very fascinating. But you really have to be willing to be open and, kind of take in information that you never thought you were going to hear before. And so, no, it's a wonderful journey.
Wow.
Yeah, I think it's a good example of when we're out there, really looking to share and be the light, so to speak, with LifeWave is we're looking for people who are open, right? Whether that would be our medical professionals, whether it be the family members that we're trying to love and serve and help, whether it be friends or coworkers. We're looking for people that are still willing to search for things that are going to benefit each other, right? Not people that say, I've learned everything that there is to know about the human body. There's nothing that you can teach me, And so I love the humbleness and the openness that is the common theme between all of you incredibly wise and experienced medical professionals on the call. Totally blessed by your involvement in today's meeting. Thank you. Thank you. Thank you so much.
Thank you, Dr. Jeff. Thank you, Dr. David. Thank you, Dr. Rachel, Dr. Larry, Dr. Karen. You guys are amazing. And this was our very first doctor's meeting. We so appreciate all of your knowledge, all of your wisdom, all of your passion for people. We just think the very best is yet to come. And we know that together we can accomplish so much, can't we? Together we can do more to serve and bless and bring light to the planet that so desperately needs it.